Good morning, Anna.
Good morning, Lana. All right, Lana.
Yes.
So today is all about you. And
how I like it.
Yeah, and just generally, what is it like to move to Amsterdam? And especially a lot of questions about healthcare come up.
Yeah.
So first of all, how did you get into helping people, and what do you do exactly?
So, yeah, Amsterdam Family Assistance, what happened is I became a mom in a very awful way. My daughter was born extremely premature and dysmature. So she was born at 29 and a half weeks, but she had the size of 27 weeks. For people who like numbers, she was 795 grams.
Oh, man.
Yeah, for people who are like, I don't know what that means, as big as your iPhone or as big as a can of cola.
Yeah. Oh,
Yeah.
luckily she's doing very well
She's
now.
doing fantastic.
That's,
and I had HELLP syndrome, so I basically kind of died a little bit. All my organs shut down, which is fine because I'm good too. But the first year, we'll just move on past
Okay,
that.
moving on. Yes.
Woo-hoo!
Yeah, and I think it's important to talk about that and realize that this is when it's important to understand more about the city and you're living in and the healthcare system because you never know what's going to happen.
Yeah,
so,
absolutely.
I think that's amazing that you share your story and that you, through that, decided to help other people.
Yeah. Yeah, so basically what it comes down to, like, I was just sitting at the playground, like as any other parent, and in the south of Amsterdam especially, there's a lot of expats. I have an American accent, so my English, I speak English to my child. So I saw mom sitting there just sort of like scared to talk to other people, and I'm not the most social person, but I can help other people. I'm a good wingman. Let's just keep it at that. So I was like, hey, what's up? You need some help? Anything? And like, yeah, well, and start talking. And then other moms came over and they had questions. And I was like, oh, well, I'm Dutch. I'm from Amsterdam. This is where you get this. This is where you do that. And at some point I started to notice that there was sort of like a line forming where people were asking questions. And I was like, well, I should make this my business.
Hey, there's that Dutch lady again. Let's ask her.
Yes, exactly. So that's what I did, and that's how it all started, Amsterdam Family Assistance.
Awesome. And how long have you been officially helping, not just at the playground, but with your own business?
Well, actually forever, every company I've worked with. But Amsterdam Family Assistance has been around for 2.5 years now, I think. Yeah, something like that. And then, of course, everybody knows I met Anna, and our lives became a perfect wonderland.
Almost our 1-year anniversary.
Yeah.
We'll celebrate.
Absolutely. Yeah. No, but what I really noticed is because I wanted to make really clear to the people that I work with that I'm not a relocator. I don't care so much about the houses. I don't care so much about the schools. It was more about my goal was to help the families. So in, let's say, the classical part where the husband goes to work, wife is behind at home with the kids, and it's like, okay, where do I go?
Yeah.
Where do I get the good groceries? Where do I get rain suits? I want to buy a bike. I'm scared to do it. I am there for the first 2 to 4 weeks to really help them out and to go and literally hold their hand.
Yeah.
I can be their first line of support for the first, like, they can call me 24 hours a day. I'm not going to get them coffee in the middle of the night, but I can tell them where to get coffee.
Exactly.
Yeah.
No, I think that is definitely necessary because you've also seen that often the relocation services that people receive are kind of bare minimum, right?
Yeah, exactly.
Here's 3 houses, pick one.
And here's a phone number.
Here's a phone number. Here's the keys. Good luck.
Yeah.
And that's just not enough because you see a lot of situations where the parents need additional support, whether it is, their child gets sick or
how does it work?
Their stroller broke. They don't know where to get a new one. Or the child's not sleeping well after the move. How do they find a sleep coach?
That happens a lot where I have to get a sleep coach in.
So what are the basics that, let's focus on what are the things that you start with that you offer to each family?
Well, it kind of depends, of course, if they're already moved over here and they're at a loss or if they're about to move here or they're not even close to moving. Mm-hmm. So there are 3 separate things. But let's imagine that I found them a house, I found them a daycare, they moved in. the house has everything they need for a family, because that's important too, because that's what people tend to forget. Like, oh, but here's a bed and a changing table. Like, there's a little bit more than that. Yeah. I also tell them which medication to bring from their home country, because let's face it, if you're from the States, you want to bring some Tylenol.
Yeah. It's a little bit different ball game out there. That's true.
Yeah. But also... really, like bikes, like I hate to say it, but there are so many people out there just trying to scam expats.
Yeah,
and that's when it helps that I speak Dutch and I am straight up telling them, like, this is the story, and I will only go to places that I trust, because I do have that knowledge and I have experience, and they can trust me, and I know the right people. And if I don't know the neighborhood, for instance, like I just had a lovely family moving into Amsterdam that I know pretty well, but there are still some, like, I want to find some outside pools and stuff. So I almost go exploring before them, and then I take them along. So it's just like jump in the car and we'll just go out and find all these amazing places. And it depends on every family, of course.
Yeah, it's really like your own personal tour.
Well, and also
guide
friend.
When you show up.
If you don't have a friend or anything, normally you would call a friend or you would call an aunt, and they would tell you this. If you have no one, it's so lonely, and that's what I'm
scary.
here for.
It's still really overwhelming, even if you've lived abroad before or just away from your home city.
Yeah, and you get really close with these families, and I like it though, because I stay close with them. They're still they're still friends. Our kids play together, but there is a sort of point, because it does get very scary, or something will happen, or your kid will get sick, and you call me, and you're sort of like. There's sort of a fine line, or where I start telling private stories where I'm like, oh, should I be telling you this? So at some point there is always a moment where I'm like, and our contract is done.
Yeah.
And now we can get
friends.
Drunk and have a talk. So,
that's great. That's great.
Yeah.
Well, we're going to talk a bit more about what it is that you're doing with the families in a bit.
Yeah.
And also going a bit more into detail about healthcare.
Yes, so important.
Super important.
Biggest thing. Yeah.
Also to kind of debunk some of the myths or misunderstandings.
Yeah.
And tell a bit from our own experience as well, as we have both
have kids
and a few special situations. Of course, we're always welcoming your questions. So if you're curious about anything we talked about or other topics, you can always write us on Amsterdam Families, either Facebook, Instagram, website. So we're talking about when people know they're going to move here or they have just arrived here.
Yeah.
What are the first steps that they take? What are the things that they need? Do you have a breakdown?
A bit, yeah. So basically, first talk to the company and the HR person.
Important.
That would be number one.
To see what's included from their side and what they can support you with, right?
Yeah, because they will either help you yourself and then say figure it out, or get you a relocator, but that could be very basic. But what you need is a BSN number. That's your registration number. You can do that already from abroad.
BSN is basically like, if you're American, Social Security number or your
registration
personal
number,
identification
exactly.
number. Okay.
You if you're going to be in Holland longer than 3 months, you have to have this.
Yes,
and it is for life. So once you have it, you're done.
Yep,
that's it. You need your Digi-ID. This is all online. People,
what the heck is that?
I know.
It's confusing.
It's basically an autograph online.
Yep.
It's your official login.
And you can log in with that to do
health insurance, banking, insurances, anything. It's one of those must things that
Can you apply for that yourself?
Yeah.
Okay.
Yeah. You need a bank account. You cannot get a bank account without the BSN number, of course. So it's first is the BSN, and then once you get the Digi-ID and your bank set up, then comes all the insurances, because you need the liability insurance, you need your health insurance, you need all of that. Again, this is a lot of information. You can also find it on our website.
Yeah.
But ask your HR person, ask your relocator, and if you feel like you're being treated as a number or you need more info, that's when you get like a local relocator that will actually sit with you, open the laptop, and find you the right insurance or whatever that fits your family.
Yeah, that's because there's a lot of options, right?
Oh my God. Yeah, you don't have to go for the First National Bank.
No,
that's for sure.
You don't, but with your employer, you can sometimes get a discount through whoever their preferred provider is, and you can insure your entire family under that same
the clause,
let's say.
Yeah, and then you still have to find, of course, your GP, your house doctor, and your dentist. That these are things that your work or your relocator won't do for you. This is where you get the local in.
Yeah, and I think a lot of people, they get a bit stuck at that point. Yeah, because they probably aren't sick when they arrive.
No.
So they don't quite think about...
And that's not something you go like, hey, do you have a good GP? Because it needs to be in your neighborhood. Like, that's when you go for recommendations.
And I think it's a little bit different than, especially from the U.S. Where I come from, when you have kids, you're very used to having a pediatrician separately from maybe the doctor you see.
No.
You don't. So... how does it commonly work when you're looking for the GP?
So basically what I did for this show, I made a bit of a list of the common questions that newcomers to the Netherlands have about the Dutch healthcare system.
Great.
So we're just going to go at them one by one. Want to take the first one?
All right. Well, first of all, could you explain then, you said you have to find a GP in your neighborhood.
Yeah. It needs to be closer than 10 minutes. It needs like walking distance 10 minutes away from you.
Okay. And how do you register there?
You literally just go over there, go, do you have a spot? And they go yay or nay, and you fill out a form and bibbidi-bobbidi boop.
Because sometimes there's a waiting list, correct?
Or you're just not allowed.
Okay. They're just full.
Yeah.
Some of them are full.
Yeah.
So maybe you should choose 3 choices where you can check if they're all, if any of them have a spot for you.
Exactly.
And then you register there. I think you have to bring your passport and fill in a registration form.
Your bank, of course, your health insurance.
Health insurance. And it's best to do your whole family all at once, whether you're sick or not, because
get it
you
over
have
with.
to be registered in order to go to the doctor.
Exactly. Yep.
Okay.
Yeah.
All right, here we go. So, inloopspreker. This is the walk-in hour. So this is the time of the day when medical treatment is available without an appointment. It's usually early in the morning, but make sure you check with whatever practice that you register at for their specific hours. Because, for example, my GP, they don't have an inloopspreker.
Oh.
No. This is a little bit...
Unconventional,
but I just want to point out that you really do need to check that. Yeah. It's super convenient, especially if you do have children, because you don't need an appointment, but you can only come between this designated period of time.
It's usually between 8 and 8:30.
Yeah, it's quite early in the morning. And just be aware that this meeting with the doctor or doctor's assistants will be shorter than a regular doctor's appointment. Yeah. So you might need a follow-up. This is meant for acute problems that need to be attended to pretty quickly. So maybe your child had a high fever and you're just feeling unsure. You can...
No, high fever we'll get to.
Not.
No. Not the fever. No, the examples are basically just like extreme ear pain, infected eye.
Well, okay, let's say, fever we'll get to, but fever may be mixed with ear pain, infected eye, a painful splinter, something that you feel that cannot wait.
Yeah, not life-threatening, of course. That's a different ballgame.
No, and also not something where you think you need a referral to a specialist.
No, exactly.
Okay.
Yeah. The doctor's assistant, because there's a lot of confusion about that. The doctor's assistant has a little bit more right to do stuff than I think in other countries, as far as I know, because they're really the first line of support. So if you have an ear problem, they will be the ones checking your ear. If you need blood, they will be the ones checking your blood. They will even renew your prescriptions. But they will also do, and this is confusing to people, they will also do the pap smear.
Interesting.
Yeah.
Now, I have to point out for my American friends that this is not a standard thing, by the way.
Oh, no.
We'll talk about gynecologists later.
Yeah.
But just so that you're aware, you can request it, but this is not an annual thing. And you can get it done just at the GP. You don't have to go to gynecologists. So I think many people, especially if you come from a country where this is done regularly, you do wonder about that.
For sure.
Okay.
Yep.
So if you need to see the doctor, this is meant for all problems, new prescriptions, and referrals. And again, you do have to call to also make an appointment outside of the inloopspreker. So that's the walk-in hour. So that's important to point out. Whether you're seeing the assistant or the doctor, you always have to call to make an appointment.
Yes.
Yes. This is important. And so I think that then they will decide based off of your situation whether you see the assistant or the doctor. The doctor does, for example, all physical and mental problem examination for adult, child, and newborn. This house doctor is not meant for extreme life-threatening emergencies.
No, for that it's always 112. That's the name. Now, if it's outside of the office hours, so at night or in the weekend, there's the huisartsenpost, and you will get this a lot.
The what?
Yeah, the huisartsenpost, which is basically the doctor's. It's medical like care for outside
after
of office
hours.
Yeah, exactly. And it's really it's basically from 5 in the evening until 7 in the morning. And there's a special number in Amsterdam, which is 0800 003060. We're also going to be posting this online because you're not going to remember now.
No, but it's something you should write it down. We have a little list in our kitchen with all these numbers. Put it in your phone, actually, because at any time of the day, you need to call this number.
For sure. Yeah. And your doctor, if you call them, they will mention this on their answering machine.
Exactly.
So, and this is meant for acute but minor emergencies that can't wait until the next day. So, for example, your child swallowed a hazardous substance, or you had a small physical accident, or an extremely high fever. And again, we'll get back to the extremely high fever.
Yeah. Sorry. There are some special, very... I would say Dutch
rules when it comes to fever.
About fever. So just be aware of this.
Yeah.
But you know what I always say? If you're feeling unsure, especially in the night, call the number.
Yeah, they
will help you. Or call your house arts during the day. They can advise you.
Yeah, they will assess the situation for you, for sure.
Yeah, I think that especially when you have young kids, you're just feeling nervous about it, right?
Yeah, exactly.
Okay. So... yeah, do doctors ever do home visits? That's a question some people have.
Yeah.
Now, this is only applicable to patients who are too sick to leave the house and maybe have a small emergency that doesn't require the emergency room. And really, you need to still call the GP or the huisartsenpost out of hours to evaluate whether or not this applies to you. Some examples of that would be post-childbirth, you have a suddenly high fever, torn ligaments, seizure with fever. And just note that the doctor will only come to check, and then they would call the ambulance if necessary.
Yeah.
Now, this is not meant for flu, fever, or anyone living more than 10 minutes from the practice.
Yeah, that's very important.
So there are some special rules. So what if you need to go to the hospital?
Yeah, this is also a thing. Back in the day, and I think in a lot of countries, it's like, well, my child something is awful going on, so we're going to the hospital. They will just charge you. Please don't do that. It will cost you an arm and a leg, literally.
No,
the hospital is really only meant for life-threatening emergencies or if your family doctor gives you a referral. That's it. So, for example, if you have a heart attack, yes, that's when you go to the hospital. Is your baby turning blue? Yes, you go to the hospital. Or you have an extreme physical accident, like you have a sword on your head, or, something extreme where you're like, that's when you go to the hospital. Right. Anything where you're panicking, that does not mean hospital. We're talking about severe things. So,
well, if you suspect a broken bone, then can you go to the ER?
It has to be really severe. Like I'm talking about bones sticking out. It's really not meant for minor physical accidents, sprained ankles, or anything without a referral.
Right. I think that the first step is always to call your house doctor or the huisartsenpost.
Exactly.
If it's something that's not life-threatening, right?
Yeah, exactly.
Okay.
Just don't go to the hospital without the referral, because you will be charged for the full amount, and baby, that's a lot.
It is.
Yeah.
Okay, so specialists. Many people wonder, how do I get to see a specialist? This is like psychologist, pediatrician, ear, nose, and throat. You have a lot of that going on with ear infections with kids, a therapist, or a gynecologist. So you have to first make an appointment with your family doctor, with your GP, to get a referral to the specialist. Without a referral, you're charged for the full amount by your insurance company. And in many places, you just can't make an appointment without the referral.
Yeah.
So if you suspect an ear infection, for example, that comes very often with young kids, you first have to go to your house doctor. And I will always say, some people have complaints about not getting referrals soon enough. I have gone to many specialists with my 2 kids. And if you're not happy with your house doctor, you can always change practices.
Yeah.
So I wouldn't say immediately, but if after a few times you're not feeling like you're happy with the service, you have the freedom to change. And this always very much depends on your house doctor, right? But you need to have a good relationship with them so that they know your family well and you can get the right referrals.
Absolutely, 100%. Could not agree with you more. A little bit of useful information. In the Netherlands, women over the age of 30 receive an official reminder for a pap smear every 5 years. Mm-hmm. Yes, an annual check is not covered by your insurance. This is a big one for the Americans.
Yes, it is. Yeah. But I will say from my own experience, you can do this every year. Just be aware that it's not always covered by your insurance. I also know that they now have at-home kits to do this.
I don't know about that, man.
It sounds a little bit weird, but just know there's options. Yeah, there's options for sure. Talk to your house doctor about that.
Now, when it comes to the fever, here we go. This is the big one.
Tell us.
A fever is not considered a valid reason to stay indoors. If your child has a fever, you are allowed to take them to the doctor if the doctor or the doctor's assistant considers it as necessary. This is true because I've heard about it a lot when moms are like, yeah, but my kid has a fever. I can't go. I'm like, yeah, you can.
Yeah.
Yes, you can.
Dutch are quite relaxed about this compared to many other cultures. I have taken that approach after having many fevers with my kids. And the normal rule of thumb is 3 days fever. And now fever, we're talking about, I would say...
Up to 40.
Up to 40.
Yeah.
However, normally, if your child has a 40-degree fever, this is quite high. So feel free to call your doctor.
Just
call them, let them know the situation. They'll likely tell you to monitor the child. But parents, if you're feeling unsure, always call. They're
If your child becomes lethargic, that's when you immediately call. You'll know.
You'll know.
Just saying they have a cold because they had, I don't know, like
38.2, not gonna happen.
No.
Paracetamol.
Yeah, and also speaking
God's
of
gift.
and for instance, antibiotics, another big thing. In the Netherlands, doctors do not prescribe antibiotics as much as doctors in other countries do.
No.
The belief is that frequent use of antibiotics increases the body's immunity to them, thus diminishing their effectiveness in the long run. And it's true. I do believe in that.
I do. And actually, you do have some recovery time needed after the antibiotics. So they really try to first see if the body can heal naturally. This does not mean that you'll never get antibiotics.
No, but only if they think it's right.
Much less than in the U.S.
Yes, exactly.
Okay, so some final things. Now, this is maybe a touchy subject. A seizure, although it may look frightening, it's not always considered life-threatening. And for this, you can call your family doctor. Your first initial thought might be to call 112.
It's one of those seizures.
Fever seizures. Sometimes this can happen with a very high fever.
Yeah.
But if your child is turning blue or has white lips, call 112.
Yeah.
If your child has a fever, it's important to dress them lightly so the heat can escape, but make sure their hands and feet are not cold. The hands and feet will conduct the heat out if they're cold, and the heat will rise to their hands. Now, these are really some topics that we're going to talk about who's going to be on the show next week. But just this final thing, we were talking about broken bones earlier. If you're hurt or fracture a ligament or a bone, whether it's broken, twisted, or sprained, always ice the injury to reduce swelling. If an X-ray is required, the clearest image can only be obtained if the swelling has reduced.
Yeah.
Now, these are some tips.
Yeah, this is stuff that I learned because I did a baby and kids first aid course. And I can tell you, for every new mom, please do this course because it'll take away the panic. You'll kind of know what to do. I mean, you'll forget half of it, but you'll be like, wait, I know this. It's not as bad as it would look.
Builds your confidence, right?
Absolutely,
and in these situations, it can also teach you a bit about when to call whom, right?
Yeah.
So,
Podcast Amsterdam.
Well, thank you so much for sharing all of your knowledge.
Oh, no problem.
relocating to Amsterdam and healthcare. How can people find you?
Well,
besides here.
Yeah, exactly. All the information about relocation and healthcare and everything we feel like families would need in Amsterdam, of course, we share on amsterdamfamilies.com. That's our most important website. If you feel as a family you're going to move over or you're here and you need help from me personally, then you can come to amsterdamfamilyassistance.com.
Mm-hmm.
So have fun, you guys.